It's now streaming. We're good.
Okay. Let me just, hold on.
Okay.
Let me just confirm.
I see it on my page. It says meeting is now streaming live on Facebook. Hey, good evening. Oh, is that a...
Let's talk erections.
Okay. Good evening. It is 5:01 sharp. It is cocktail hour tonight. Get your drink. And what I mean by that is maybe some tea. I got my hot tea, Tamayakucha tea. Maybe get some water. We're going to do this in a healthy style tonight. Anyways, tonight we're going to do a focused topic. We're talking oral medications to improve erections. I'm urologist and men's health specialist, Amy Perlman.
And I'm Michelle Perlman, gastroenterologist and physician nutrition specialist.
Right on.
You know, I'm just digging these eggplants. I'm sorry.
So tonight, 5 p.m., it is cocktail hour. And I want everyone, I'm going to give you about 10, 15 seconds right now. Get a piece of paper that you can draw with, or a cocktail napkin or something, or maybe just do some air drawings, because we're going to simplify this tonight. Learning objectives. We're talking normal penile anatomy, normal penile physiology, the mechanism by which oral ED therapies work. We will discuss similarities and differences between the medications. I love it, Michelle. You got your picture. We'll grade it at the end. Okay. And maybe most importantly is where to get these medications for cheap. Everyone has their napkin? All right, draw a big circle on there for me. The penis is a fairly simple organ. Now, no man likes when I tell him that, but it really comprises 3 tubes. And the reason why we're going to start by talking about anatomy is that it's hard to understand abnormal if you don't understand the normal. And so we are going to start with the normal. 1 tube, one of the erectile bodies, and you have a paired structure. So those are 2 erectile bodies, and those erectile bodies are actually connected in the middle by a thin septum right here. The 3rd tube is the urethra. That's the tube that you urinate out of. We have 2 main arteries that go to the erectile bodies, 1 in each erectile body. Those arteries are called the cavernosal arteries. If you look at a pen, let me see if I have a good pen here. Hold on, be patient, be patient. Give me 1 sec. All right. So these fancy pens here, this is the Pilot G207. I don't get any kickbacks from that. But if we take this pen right here and I push this out, the tip of the pen, I know it's difficult to see, but that's the point, is pretty small, right? That's about the size, the diameter of the artery that's in each erectile body that gives blood flow to that erectile body. It's pretty small. Now, if we look at the back part of the pen, see this right here? That's about the size of a coronary artery. That gives blood supply to the heart. So you can imagine why with, the high degree by which we see coronary artery disease, that we would see way more erectile dysfunction disease, because that vessel is so much smaller, so it can get clogged up much more easily. Then we have the dorsal arteries, and that's a paired structure as well that sits on top of the penis, and that gives blood supply to the tip of the penis, or the glands. We have venous drainage. So blood flow comes in when you have an erection, and then it drains out by a different system. And there's a big vein on top of the penis as well, and then many other veins throughout the penis. And then we have the nerves. So the nerves are part of the dorsal neurovascular bundle. That's this area right here. And those are responsible for sensation to the penis. Let's talk physiology, Michelle. What are your thoughts? You want to know how this works?
I'd love to show you my little
okay. All right, let's see your drawing.
Kind of looks like a teddy bear.
I can see it. What color ink are you doing?
Red.
Okay, maybe do you have like a Sharpie? Find a Sharpie and then we'll talk. All right. So physiology, we have arousal. So that could be looking at a magazine. It could be, seeing someone like myself from across the room. I'm just kidding. Just kidding.
Not proud of yourself.
Trust me, every day I am humbled at work. So arousal, and what that does is it stimulates the release of nitric oxide from nerve terminals and endothelial cells. And nitric oxide is really the main neurotransmitter that's involved in relaxation of the tissue in the erectile bodies. And these erectile bodies, I want you to think of it as, let me just grab another prop here. Oh my God, I came prepared tonight. This is unusual, but here's a sponge, okay? This sponge, what this tissue looks like with all these openings here is really similar to the spongy tissue that's present in each of these erectile bodies. So you can imagine, let's say here's the artery that's going into the sponge. When you have increased blood flow through this artery, it fills the spaces in the sponge, and that those spaces relax and they fill with blood. And so this gets soaked, or, you know, what we would call is like a rigid erection is when this gets full of blood and it accommodates that increased blood. Okay. And then when that happens, it pushes, we can look at this. This is actually the first time I've used this sponge to demonstrate this, and I'm feeling it. I'm feeling this vibe. But this blue thing right here, you know how it's like, it's not as spongy, like you can't like pull it apart. It's pretty thick. It's kind of like fibrous tissue. So you can imagine that that fibrous tissue, so it does surround those spongy erectile bodies. So when this gets bigger and engorged with blood, it kind of pushes against this area right here, and it literally chokes off the veins from draining blood out of the penis. So you stop, you crunch up those veins, or you kind of push against those veins so that the veins don't drain the blood out. What? Huh? What?
Smush the veins.
Okay, you smush the veins. All right. So to get a good erection, it's pretty simple. And we try to say, oh, you know, we blame it on all these other things. And it is kind of complicated. But when we really look at the basic anatomy, to get a good erection, you need good blood flow in, and you need the veins to be smushed so that they don't drain blood out. Sensical? No, sensical. I know this is a busy slide, but it's really important because we have to understand this slide in order to understand the mechanism by which the oral medications work. Michelle, can you see this mouse here, the arrow? Just want to make sure you can see it well. Okay. We have endothelial cells here, and we have nerve terminals here. And with arousal, you get release of these nitric oxide from both of these. And what the nitric oxide does is it activates guanylate cyclase, which converts a molecule we call GTP into cyclic GMP. And then by a variety of cascades here, that cyclic GMP leads to smooth muscle relaxation. That's the relaxation of all that tissue and the blood vessels in the penis that allows for increased blood flow and for that tissue to expand and become rigid. Now, PDE5, this is an enzyme that breaks down this molecule. So when this enzyme breaks this down, you no longer get this, okay? So when you essentially run out of the nitric oxide, that's when the erection goes down. Now, right here, critical part of the slide, PDE5 inhibitors. That's our Viagra, our Levitra, our Stendra, and our Cialis. This inhibits PDE5, which allows this whole process to keep happening. And that allows the erection to improve and last longer. You with me?
With you.
Cooler? All right, cool. So let's talk about the 4 oral medications. As I mentioned, we have Viagra. That's the blue pill. That was hot in the 90s. Then we have Cialis. Actually, Levitra came out second. Cialis came out after that. And then Stendra is the new puppy on the market. Now, Viagra has been out for, over 20 years at this point. And, what I'm going to do with this slide is I'm going to focus on Viagra and I'm going to focus on Cialis. The reason why I'm not focusing on Levitra or Stendra is, 1, they tend to be more expensive. And 2, they work similarly to Viagra. So in my practice, unless somebody specifically wants to try one of these, I typically, go with Viagra or Cialis. So let's talk about the main differences here. Now, because Viagra's been out for a long period of time, they have generics. For a while, it was cheaper. And so that was a big draw. I had some patients who would come in to say, Doc, I got a prescription for Cialis. I didn't even fill it. It was way too expensive. They tried to charge me, $30 a pill, $60 a pill, whatever. And it was just cost prohibitive. And that makes sense. That's very expensive for a single pill when you're not even sure if it's going to work. But let's talk first in terms of how long they last. All right, Viagra, and depending on what you look at, you're going to have a different, the numbers are going to differ slightly. So don't, stick to any of these too much. But Viagra, the window of opportunity for it to work is about 4 to 6 hours. With Cialis, it can work for up to 36 hours. That's a big difference. Some people refer to Cialis as the weekend pill. You can take it on a Friday night. It might still work on a Saturday night. So what does that mean? Well, it means that it allows for more spontaneity, right? There's less looking at the clock to be like, okay, well, it's 4 p.m. or it's 5 p.m. It's cocktail hour, but am I going to get lucky tonight? I don't know. Should I waste this medication? What are the odds, So with Cialis, you have a little bit more time, to make that encounter happen. The next thing is whether you can take it with food. Now, with Viagra, you shouldn't take it with food. In fact, you should wait at least an hour after last eating before you take it. And especially, wait longer if you eat a fatty meal. Now, Michelle, you as a gastroenterologist and physician nutrition specialist, you're going to say, well, how about you don't eat the fatty meal and maybe your erections will improve. But, if you're going to eat a fatty meal, okay, I'm not saying do it, then wait a little bit longer before you take something like Viagra in terms of increasing your absorption. With Cialis, it doesn't matter whether or not you take it on an empty stomach. So that's the big, the second factor there. Let's see. Now, the third thing is the Cialis can also be used, both these medications can be used on demand. Viagra, you want to take it about 45 minutes to an hour before you want to be sexually active. I find that Cialis takes a little bit longer to take effect in the body. So I would give it at least 2 hours before you want to be sexually active, meaning if you're, planning on getting lucky at 8 p.m., don't take it at 7:45. Comprendo? Comprende? Okay.
Let me ask you a question. The people who get the erections and they get priapism, where the erection won't go away, and that can be kind of an emergency situation. Yeah. Is the Cialis, is that more at risk for causing priapism?
Yeah, good question. The answer is no to that, and that's a really good question. I did not prompt that question. So here's the dealio. People don't actually get priapism, that painful erection lasting greater than 4 hours, when they take these medications appropriately. Meaning, if I'm called into the ER because someone has a priapism, it's typically because that person either took too much of the medication, okay, more than is recommended. Perhaps they took it with a medication like trazodone. Trazodone is taken to help people with sleep, but taken together with trazodone, it can increase risk for having priapism. The other thing too is when it's taken.
That's what I always remembered from medical school was trazodone.
Yeah.
The nickname was trazobone.
Right, correct. Yeah, you retain some knowledge there. That's awesome. Kudos to your medical school professors. Let's see. The other thing too, when we get urine samples for some of our ER patients, they test up as being cocaine positive. So by no means am I reinforcing that anyone does cocaine, but like if you do it, don't take it with Viagra or Cialis. Space those out. Okay, but don't do cocaine. Seriously. Let's see. Now, because Cialis stays in the body for a longer period of time, if you have side effects with the medication, the side effects tend to linger for a longer period of time compared to Viagra because it just takes longer for your body to get rid of it. Now, with all 4 of these medications, it's not that one necessarily works better than another overall. Everybody is different. I have plenty of patients who say Viagra works better for them, or Cialis works better for them, or Levitra works better for them. So that it just varies person by person. Side effects profile is the same thing. I have some patients who just tolerate Cialis better than Viagra and vice versa. And then the big thing too that we'll talk about is cost. And with a coupon, and I'll show you through GoodRx, cost is actually less of a thing in terms of the differences between these medications as it used to be. And certainly if you don't use the coupon, you're going to see a huge difference in cost. Michelle, what questions do you have about these medications? Nothing. So side effects that people can have from any of these medications can be heartburn, sinus congestion, facial flushing, headache, muscle aches. Those are the main ones. Sometimes they can get better with repeat use. Now, the big thing too with these medications, you have to be stimulated. So if you take these medications, you won't just get an inappropriate erection. You have to be stimulated or aroused for them to actually work.
Well, I know I was going to say, so what about the people that come in to the ER with chest pain? Why on all the movies does the ER physician say, did you take any Viagra?
Yeah, great question too. Because you can't take any of these medications with a nitrate. And so if you're having chest pain, sometimes they'll give you a nitroglycerin to help with the chest pain. So that combined with any of these medications can really tank your blood pressure to a very dangerous level. So if someone, yeah.
Right?
Huh?
Clear. So when you say tank, you mean people's blood
drop the blood pressure. Exactly. And I do have some patients who have nitroglycerin or sublingual nitro written on their medication list. And I will ask them, do you carry this around? Have you ever had to take it? And they might say, oh no, I had that prescribed 10 years ago by my cardiologist, but then I had a coronary artery stent placed and I haven't had any issues since. For that person, I would feel comfortable putting them on these medications. And if there's ever any question, I just reach out to that person's cardiologist to see where we're at with the nitroglycerin.
And that also covers people on long-acting nitrates, right?
That is correct. Some people take nitrates every day. So that person, I would definitely not give one of these medications to. But, in some of our upcoming seminars today, we're focusing on the pills, but we're going to talk about the other therapies that people are candidates for if the pills either don't work, if they have bothersome side effects, or, if someone has heart issues where they're not able to take these medications. So yeah, that's another reason to stay tuned, right, Shelly P, Mishy P on the eggplant. Right. So let's talk cost here, because cost is critical, and then we're going to wrap it up. So if you're on a computer right now, I want you to humor me, and I want you to go to Internet Explorer, Chrome, whatever you want. And I want you to type in GoodRx. Now, I don't get paid by GoodRx. I make nothing from this, but I'll tell you, finding good prices for my patients for these medications has completely changed my practice, because they can actually afford the therapy that we talk about in the office. And GoodRx is a great site. It is a company that contracts with big pharmacies around the country to get the best price for you for certain medications at your local pharmacies.
Hey, Amy,
yes.
I love how you're holding that mic like you're singing a song.
I know. I just want to sing about this because I'm so passionate about it. I'm passionate about cost conscious care for our patients. It matters. So you go to GoodRx, and then I'm just going to kind of walk you through this here. So stay with me. You can type in the medication. So here I typed in sildenafil. That's the generic, form for Viagra. You can also type in Cialis here. Then, tablet, and then this is a drop-down menu here. This is 20 milligrams, but you can change that to 100 milligrams. And then you can, another drop-down menu, 30 tablets. The higher the quantity, the cheaper it's going to be per pill. I ask a lot of my patients, well, how many, Billy, Bob, whatever, James, how many do you want me to write for? And they're like, oh, well, you tell me. And I'm like, no, buddy, like, you want 1 million pills of Viagra or Cialis? Like, I'll write that for you, but it's going to be 1 million times $1. So you're going to owe $1 million. But otherwise you can write for however many, the patient wants. And then you scroll down and you look at the different pharmacies. Now, I'll tell you, as a provider, a lot of our patients have asked us, like, oh, doc, well, where should I take it? And we'll say, like, oh, you can take it to wherever, CVS, Walgreens, Hy-Vee, Kroger, but it actually matters. And if you scroll down on these sites for different, on the website for different medications, you will see that price matters, and every pharmacy has a different price. Like Walgreens, for example, is going to be more expensive for these oral PDE5 inhibitors compared to Hy-Vee. So like for Cialis, it's about $1 a pill for the maximum dose of Cialis through GoodRx. Now, before we wrap this up, I need to just drive home a few important points. you need a prescription for these medications. So whoever's prescribing this medication for you needs to send the prescription to the pharmacy based on where you want to take it, based on the price that you see on this list. Then you need to print out the coupon. You can either print out the coupon for that pharmacy, or you can pull it up on your smartphone and bring your phone to the pharmacy and show the pharmacist. Third, you need to tell the pharmacist, I don't want you to run this medication through my insurance. I want to pay cash and I have a GoodRx coupon. Oftentimes, my patients have told me that the pharmacist will run it through the insurance and it'll be very expensive. But you say, I have cash. I want to pay cash for this prescription and I want to use this coupon. Four, if the pharmacist says, well, I've never heard of this before, I don't know how to do this, then, ask to speak with the manager because they've already contracted for this price and you should be able to get this price. You can use these coupons however many times you want. Just print out a new coupon, bring a new coupon in every time you go to fill your prescription. The GoodRx is good for it doesn't have every medication on here, but if there are medications that you're filling that are expensive, I would encourage you to look on GoodRx to see if you can get a better price. This is outside of insurance. All right, so I want you to remember this happy face. This happy face is important. This happy face is simple and wildly complex, but it's important to understand the normal so you understand the abnormal, so you understand how these medications can help improve your situation. And that is the end of happy hour, cocktail hour today. We thank you. Stay tuned, stay healthy. Knowledge is life. Michelle, break it down for what you're talking about tomorrow.
What did we say?
Cow milk, right?
Cow.
God,
Yeah.
I gotta be honest here. Talk to me.
Tomorrow we could probably do it a little bit earlier since
right.
it's a Saturday. We could do maybe early afternoon, but we're going to talk about, are you a coward for not eating dairy? So we'll talk about what types of dairy are out there, what are the macronutrients, and what is lactose, what is it made up of, and when we talk about sugar and fat content in skim versus whole milk, what's the difference? And then we'll compare dairy options to your non-dairy options, like your almond, your cashew milk, your oat milk, and your soy, and kind of give you a better sense of, based on whatever your food preferences are and your weight goals, which option may be best for you.
Oh, that sounds awesome. All right. Thank you for tuning in. Stay healthy, stay safe.
Cheerio.
Cheerio.